Hey everyone, welcome to my channel. In this video I'm going to go over 4 steps for an acute hip flexor strain. So if you strain your hip flexor, you may notice that pain in the front part of the upper thigh area here that may radiate down into the thigh, can radiate into the abdominal area. It just depends really from person to person. The first thing we're going to work on is going to be a stretch. It's kind of a modified forward lunge stretch. What you're going to do is we're going to say that my right hip is the side that's had the hip flexor strain. I'm going to step forwards with my left foot, kind of lunging forwards. I'm going to lean in. I feel that stretch here, and I can add another aspect of the stretch by turning away to the opposite side. So I'm going to turn away. I really feel that stretching in there. I'm going to hold that position maybe for 20 to 30 seconds and come back. Go back into that again, turn, hold that 20, 30 seconds and relax. And repeat that for 2 to 3 times, several times a day. Our next stretch is going to be a standing hip flexor stretch. What you're going to do, again, we're going to say it's my right hip flexor that's been strained here, one of the right hip flexors that's been strained. I'm going to pull my foot up. Now, if you need to support yourself and hold on for balance and stability, you can. I feel that stretch. I'm going to pull that back even a little farther. You can lie down if you'd like on your bed or a couch so that your leg kind of hang off the side and pull that back. That's fine too. But you're going to feel that stretch. Try to hold that for around 20 to 30 seconds. Repeat that 2 to 3 times, several times a day. Now that we've completed a couple of stretches, I'm going to show you a loading strategy because we want to start to load that tissue to promote the healing. So this, you're going to start off in a sitting position. You're going to take your hands, you're going to put it on top of the thigh down towards the knee. And I'm trying to pick my foot up in this position. So I'm trying to flex my hip, pull my foot straight off of the floor, and I'm going to resist. I'm pushing down with my hands. I'm trying to bring my foot off the floor. I'm going to hold that for around 10 to 15 seconds and relax. I'm going to pull up again, hold that for around 10 to 15 seconds and relax. I'm going to feel that in this area here. Now, initially, you're only going to want to start maybe 25% effort, maybe even 10% effort, because remember, it's pretty inflamed and irritated. This program here is usually for the first 2 to 3 weeks of you've had that hip flexor strain. Of course, that also matters based off if you're an athlete, if you're in the middle of a sports season, all those kind of things. So you're just going to start with that, trying to bring my foot up. Although there will be no movement, the foot's going to remain on the floor. I'm going to counter that force by pushing down with my hand into my thigh. And you're going to repeat that for 2 to 3 sets, again holding for 10 to 15 seconds for around 5 repetitions. What you can do to upgrade that exercise is going to be in standing position. So what I'm going to do is take my foot and push out against a door facing or just the wall. So if the wall wasn't there, then I'm going to bring my entire lower extremity to come out like I'm, kicking a football or soccer ball, something like that. So I'm going to put my toes up against this door facing, and I'm going to try to kick out, although there will be no movement. I feel that contraction right there in my thigh muscle. I'm going to hold that, relax, contract again, hold that, relax. Now to upgrade that even further, you can take leg weights or you can use exercise bands and actively go through the movement. If you do that, then that's going to be usually 2 to 3 sets of around 10 to 15 repetitions if you're using bands, those resistance bands, or some sort of cuff weight around the lower leg. Our 4th tip is going to be we need to restore normal gait patterns, no more walking, really working on our stride length, making sure that our heel hits first, and we kind of go through that movement, and then we push off our toes. So we're going to work on several aspects of that, both going forwards and going backwards. So in walking forwards, we're going to work on taking a nice, good stride. Our heel is going to hit first. We're going to roll through and then push off of our toe as our other heel hits the floor. And so again, what that's going to look like is work on heel hitting, rolling through, pushing off the toe, heel hitting, rolling through, pushing off the toe. You're going to really focus on that heel strike and rolling and pushing through off the toe. You may notice some difficulty initially with that on the affected side with your ability to extend the hip. So a lot of times your stride with that is going to be asymmetrical. You're going to notice a better stride on the unaffected side versus the side that's been irritated or injured. So when you go through that toe off portion, there may not be as a lengthy stride with that. So you're going to really want to work on making sure that you're over time increasing how far when you push through with your toe, how far that space is to really work on that to restore normal stride. You also can work on standing marches. So you can just work on standing marches. I usually have patients when they do this, maybe for 20, 30 repetitions for maybe 3 or 4 sets, or I may have them do that for 30 or 60 seconds. Just kind of repeat that. You can work on speeding that up, going faster, adding in arm swings with that. That works really well. So I may add in leg weights. I may put on those leg weights to the bottom of the legs, very light, maybe 2 pounds, and just work on that, kind of restoring that normal reciprocating movement. You also can work on backwards walking. I really like backwards walking, and that's just going to be the opposite of the heel hitting first. Now our toes are going to hit first. So we're going to step back, my toes hit first, I roll through, come off my heel, and then the next foot goes through that sequence with the toe hitting first. And that's something that I may have someone perform that for maybe 20 feet or 30 feet and repeat that 5 or 6 times. Now, as an adjunct to these 4 tips, you can always add in moist heat or ice, whichever you prefer. Some people also use vibration therapy, so there's percussive massage guns, those types of things. Whatever that you need to use to facilitate the movement, increase your kinesthetic awareness in that area, and make the pain more tolerable so you can go through your movements and exercises to restore normal mobility, both in standing and sitting position. Thanks so much for watching. I hope this video helps with your hip flexor strain. Be sure to hit that subscribe button so you can stay up to date on all my content.